Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, an increased buildup of fat in the liver. Major risk factors include obesity and type 2 diabetes, though it's also associated with the usually causes no symptoms. And when symptoms occur, they include fatigue, weight loss and abdominal pain. So, to discuss on fatty liver diseases, I'm being joined by Dr Pankaj Bharali, consultant medical gastroenterologist from Health City Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Dr Pankaj, for joining to Good Life, the health show today. So, today the topic which we have taken is fatty liver diseases. Now, at first, like the viewers who are watching our show will like to know that what exactly is fatty liver diseases. So, if you could just elaborate or just put some light on what is fatty liver diseases.
Okay. First of all, thank you for inviting in your show. In layman language, if we say fatty liver disease, it simply implies that deposition of fats in the liver. As such, it is not problematic. But if it progresses, it increases in the severity, it will lead to liver damage. But it occurs in stage. It is not like that fatty liver is there. It will progress to inflammation, steatohepatitis, we say this. Then it will slowly progress to cirrhosis. Then it can lead to different problems the patient can have.
Okay. So, step by step things get more stronger, or the causes of the diseases get more stronger. So, what are the types of fatty liver diseases, Pankaj? What is?
See, if we broadly classify fatty liver disease, we can differentiate into two types. One is alcohol-related fatty liver disease, and second is non-alcohol-related fatty liver disease. So today we will be focusing more on this non-alcohol-related fatty liver.
Non-alcohol-related.
Yes. And this non-alcohol-related fatty liver disease, it is again divided into two types. One is primary and one is secondary. And we will be focusing on the primary thing. The secondary part, it is due to some other diseases, few genetic things related to few medications, surgeries. This we won't discuss today. We will be mainly focusing on this primary non-alcoholic fatty liver disease.
So, if we want to know about that non-alcoholic primary fatty liver diseases, so what would be that? What is the basic idea one should know about it?
See, the main problem with fatty liver disease is it has no symptoms.
No symptoms?
Yeah. Most of the time it is detected incidentally. Patient will come to hospital for some other reasons. Ultrasound is being done. So, we get fatty liver disease. Then only patient is referred to us for further evaluation. The sad part is that because patient is not having any trouble, any symptoms, they take it lightly. So, it progresses slowly and slowly without the knowledge of the patient.
Because there is no symptom. Like
if you have any pain related to the gallbladder or appendix, patient will immediately end up in hospital and he'll get things done. In this case, as patient is not having any symptoms, he delays it for a time being.
So, it is basically detected if suppose a person is having some other kind of ailment and goes to a hospital or a doctor to see it. So, when the test or the ultrasound is being conducted, then is being seen that a fatty liver. So, on that part, how is the treatment being done? Do you do the treatment on fatty liver first, or the ailment which the patient has gone to see you for that?
See, if the patient has come for some other reasons, he will be treated for those things only. This fatty liver part, this is completely different. We have to go through the evaluation and management part of this fatty liver disease is different from the other diseases. That's why.
So, what are the risk factors if we want to know about it, and who are mostly affected? Which is the age group we are talking about?
See, fatty liver disease, even simple language if you say, it may be due to the lifestyle we have taken nowadays. Our modern lifestyle, westernized lifestyle, the way we eat, the way we live, our sedentary habits, this all leads to our fatty liver disease. And the most important risk factor, as you have told in the beginning of the show, this is the obesity. At least in 75% cases, it has been seen that the obese people have fatty liver disease. And the next important thing is diabetes. Similarly, in the obesity, 75% is affected. Likewise, in diabetes also, around 75 patients are affected with fatty liver disease.
So, is there anything to worry about, doctor? Because like if suppose a person has done an ultrasound and got to know about fatty liver disease, so is there anything to worry, or what is the precautionary measures one has to take? But first of all, like if there is any other ailment, so on that note, how is the precautionary measure working?
See, if I say in the simple language, fatty liver disease should be taken as flag bearer for other diseases. The fatty liver disease, it won't restrict itself to the liver only. If it progresses, you will have problems, your kidney problems, your heart problems, your brain related problems.
Okay.
It will come in a sequential way.
Okay.
So if you are having a fatty liver disease, don't take it as a benign condition. You have to gear up, you have to do some things, you have to do some tests, you have to modify your lifestyle, then you have to proceed for other things also.
All right, all right. We'll have more discussion, but just to tell our viewers that our numbers are flashed on your television screen. So if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask your question. Dr. Pankaj Bharali is with us, and probably he will be giving you all the answer. Now, Doctor, coming back to you again. Now, we were discussing on the risk factors. Now, who are the persons who are mostly affected? Lifestyle is one of the key factors for the fatty liver disease. Now, person has a lifestyle nowadays, everybody is busy with their lifestyle, with office or any kind of work. So on that note, how a lifestyle can be changed, we'll come to that. But what is the disease that is burden in India?
See, before coming to the disease burden in India, let's talk about the disease burden globally.
Okay.
So globally, if we take the world population around 7 billion, almost 25% of the patients are affected with fatty liver disease. So this number is staggering. It is very huge number.
Okay.
And if we come to the Indian population, around 140 crores, if we take 140 crores as the Indian population, current population, around 25% is having your fatty liver disease.
Okay.
Now you can think of that number. And the problem is that it is not only affecting the adult person, it may affect your children also. Okay. So this is quite a huge number, and we have to think about it.
Absolutely, it's a huge number, and maybe hospitals and doctors like you, of course, are having a time-to-time research on it as well. All right, Doctor, we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মানে গ্যাস্ট্ৰিকত আপোনাৰ গৰম পানী কিমান মানে সুবিধাজনক হয় গৰম পানী খালে
Okay, আপোনাৰ গ্যাস্ট্ৰিকৰ প্ৰবলেম আছে কিমান গৰম পানী খাব লাগে
হয় মানে গ্যাস্ট্ৰিকৰ প্ৰবলেম আছে তো ৰাতিপুৱা গৰম পানী খালে কিমান মানে লাভজনক হয়
Okay. How effective?
চাওক গেষ্ট্ৰিকৰ বস্তুটো আপোনাৰ সেম যেনেকুৱা ফেটি লিভাৰ কথাটো মই ক'লোঁ এইটো আপোনাৰ লাইফষ্টাইল ৰিলেটেড হয় অকল গৰম পানী খালে আপোনাৰ যে গেষ্ট্ৰিকৰ প্ৰবলেমটো কমিব তেনেকুৱা একো কথা নাই মানে মেবি এইটো আপোনাক হেল্প কৰিব পাৰে কিন্তু যে আপুনি গৰম পানী খালে একেবাৰে গেষ্ট্ৰিকৰ প্ৰবলেমটো নোহোৱা হৈ যাব তেনেকুৱা একো নাই মানে
All right. Thank you so much for calling at this point in time. And numbers are flashed on your television screens, viewers. So please call up and ask your question. So this is probably a very common question being asked who is being facing. And nowadays we see that 9 out of 10 people facing with gastritis because of the lifestyle which we are leading, Doctor. So we were talking about the disease burden in India. You already mentioned about the percentage. Now, is simple fatty liver or a matter of concern? When should one worry? Like how should person take it? Is it serious or one should not worry, or how should a person lead their lifestyle?
See, if there is only simple fatty liver, there is nothing much to worry.
Okay.
But if it progresses, the problem is that when it will progress stage by stage, like from fatty liver to steatosis, what we say inflammation, the patient won't be having any symptoms in the fatty liver stage also.
Okay.
He might not have any symptoms in the inflammatory stage also.
Okay.
This is the main problem, and so we miss the patient.
So this is the major concern actually.
So we have to act on that part. If we act on that part, then the progression of the disease from the inflammation to the cirrhosis part. Cirrhosis means in common language we can think about scarring of the liver. So this progression we can halt. So our main focus is to halt the progression of the liver disease.
So this is a problem because like if you have no symptoms, how you will judge, how you will make out that you are facing any problem unless and until you go to a doctor and have some kind of test. So this is actually very critical. What do you say, doctor? How will a person, because you are keep on going with the lifestyle which you are already leading. So on that note, how a person can control or how a person can know that one or the other, you have to take a measure on it.
See, for this thing, first you have to know about the severity of the disease. So for that, we have to go through some tests. Basic tests like lipid profile, liver function test. Ultrasound will give you some idea about the fat content in the liver, but it is not that accurate. So few other non-invasive tests like we commonly says fibroscan. So fibroscan gives us some idea about the elasticity of the liver, how the liver is functioning, what is the percentage of the scarring the liver is have. So with the help of those diagnostic tests, we can have a fair idea. These are not accurate, but we can have a fair idea about the severity of the disease.
All right. Doctor, we have a caller.
Yeah.
Let's take the call. Hello.
Hello.
Hello. আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
মই জানিব বিচাৰিছো যে ইভিনিঙত আপেল খালে এনেকুৱা কিবা গেষ্ট্ৰিক টাইপৰ এনেকুৱা ইজ ইট লাইক ইভিনিঙত বেড নেকি আপেল খোৱাটো
চাওক এপেলটো কিছুমানৰ উপকাৰ কৰে অকল এপেল বুলিয়ে নহয় আপোনাৰ ৱাটাৰমেলন পিচ পিয়াৰ সেইবোৰ কিছুমান এনেকুৱা ফ্ৰুটছ আছে সেইবোৰ খালে কিছুমানৰ উপকাৰ কৰে যদি আপোনাৰ সেইবোৰ খাই অলপ তেনেকুৱা গেষ্ট্ৰাইটিছ বা গেছ ৰিলেটেড তেনেকুৱা আপোনাৰ লাগিছে আপুনি কমাব পাৰে সেইটো বস্তু
All right. Thank you so much for calling. All right, doctor. So this is also one kind of question and very common question being asked. Like we will come to that diet part as well, which fruits to take up and which vegetables or what kind of dietary part. But the first off, like how to diagnose a fatty liver disease? Like if a person has some kind of like intuition of something, so does a person has to go directly to a doctor or a gastro?
Yeah, he can come to a medicine specialist also or he can end up with a gastroenterologist also. As I said, symptoms are very few.
Very few.
Either it is completely asymptomatic or he may have some abdominal discomfort or some fatigue like that. If in investigation we find out the severity of the disease, then we can proceed with the lifestyle interventions and other interventions that is required to control the progression of the disease.
Okay. So what is the first test? What are the basic tests being conducted on the patients?
So basic tests, if we see, first line is your ultrasound. Second will be your lipid profile.
Okay.
Liver function test. And then we can go for fibroscan also.
All right. So there might be, say, if it is detected, now after a diagnosis part is done and the patient is being detected with fatty liver diseases, so treatment part comes.
Yeah.
So what is the treatment part, doctor?
See, the treatment part is often easy but difficult to apply in the real life.
Okay.
This is the main problem. We consult the patients also, but still they have the same problem that, sir, we can do it, but we can't continue the treatment.
Continue it. Okay.
So the main treatment factor is your lifestyle modification. And the number one thing is weight loss.
Okay.
So weight loss, by reducing your diet or by exercising, you have to lose weight.
Okay.
So regarding exercise, it is not like that you have to train with only weights. You can do aerobic exercise also. Both these exercises are equally good.
Okay.
And the recommended guidelines, they say at least 150 minutes of exercise per week is at least recommended.
Okay. So it depends on the patient as well. It's not only the doctors who will prescribe you with everything and you don't follow it. So it goes hand in hand actually. So treatment part is totally on yourself because if you don't change your lifestyle, so that will be leading to more serious conditions as well. So doctor, have you gone through any serious condition? A person is having a serious condition. So on that note, how is the treatment procedure being taken up?
See, in common language, when we see serious condition for fatty liver disease, a doctor will immediately say about your decompensation of liver disease. Decompensation in common language, we can say as liver failure.
Okay.
Your liver is not working. Your liver is getting scarred and it is not working. The proper normal functions what liver is thought to do, it can't do that things.
Okay.
So those patients, they will present with different symptoms like swelling of the legs, their tummy will swell due to fluid in the stomach. Patient can have jaundice, patient can have itching, severe itching, or patient can have blood vomiting, black stool, or he can have altered sensorium. So these are the part of cirrhosis of the liver, which is due to progression of the fatty liver disease.
Okay, okay. So that comes in like if
this is the later part.
Later part.
Yeah. The main thing is that we can prevent this thing. If we apply this lifestyle modification earlier, we can prevent this thing.
Okay, okay. Doctor, we'll have more discussion, but we have to take a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You are still watching Goodlife, the health show with me, Pooja, and we are having a fruitful discussion on fatty liver disease with Dr. Pankaj Bharali. So, doctor, coming back to you again. Earlier to break, we had an fruitful idea about what exactly is fatty liver disease and who are the age group we are talking about, how it is diagnosed, the treatment part. If anything you want to more add on the treatment part as well, what would be that?
See, regarding treatment part, as I have told about the exercise part.
Exercise part.
Next is diet. The dietary factor is the most important thing. And for weight loss, 70% you have to do dietary modification, 30% will come for your exercise part. And regarding dietary things, main thing is the fast food we are taking now.
Okay.
So this is one of the main common factors.
Doctor will come on that, but
Yeah.
we have a caller at this point in time. Let's take the call. Hello.
Hello, namaskar. Hello.
Hello.
হয় মই জানিব বিচাৰিছিলো গেষ্ট্ৰিক হলে মানে উগাৰ আহি থাকে মানে কিবা এটা খোৱাৰ পিছত মানে উগাৰ আহি থাকে
Okay. Okay.
আৰু মানে মোৰটো অলপ ব্লৰ টাইপ হৈ থাকে
Did you get him?
হয়তো জানিব বিচাৰিছো
Alright, so আপোনাৰ gastric হলে উগাৰটো যে আহি থাকে
মানে কিবা এটা খোৱাৰ পিছত মানে উগাৰ এটা আহি থাকে তো গেষ্ট্ৰিকৰ কাৰণে হ'ব পাৰে নেকি
সেইটো আপোনাৰ কমন লেংগুৱেজত ক'ব গ'লে গেষ্ট্ৰিকৰ কাৰণে হ'ব পাৰে সেইটো আমি আমাৰ মেডিকেল টাৰ্মছত GRD বুলি কওঁ ৰিফ্লাক্স চিম্পটম মানে সেইটো আপোনাৰ ডায়েটৰ লৈ কথা আপুনি যদি বহুত পেট ভৰাই বেছিকৈ খাই আছে খোৱাৰ লগে লগে আপুনি যদি শুব গৈ আছে তেতিয়া এইবোৰ প্ৰব্লেম বেছিকৈ দেখা দিয়ে মানে আৰু লগত যদি আপুনি সিগাৰেট খায় বা জৰ্দা পান সেইবোৰ খায় মানে বেছিকৈ তেতিয়া হ'লেও সেইটো প্ৰব্লেম আপোনাৰ দেখা দিব পাৰে
All right. Thank you so much for calling. And Doctor, this is also a very common question. Now, if I would like to ask you that after having any kind of meal, your morning or your day, or maybe especially night meal, so what is the gap you should take? You should immediately go and have a sleep or something? There should be a gap.
This is the
because that is the most important thing.
This is the most common mistake people do.
People, yes.
See, we Indians are used to take 3 major meals, 2 snacks like that.
Right.
Okay, the portion of the meal in fatty liver disease or in any lifestyle modification, you have to decrease the portion of the meal, be it in the breakfast, be it in the lunch, or be it in the dinner. And second thing is that after taking the meal, you are not supposed to go to the bed immediately.
Okay.
There should be a gap of at least 20 to 30 minutes.
We have seen a common mistake, but
Yeah.
this person making okay.
And the nighttime meal, it should be very light.
Okay.
If a person is previously he was taking around 4 to 5 chapatis or one rice plate full of rice, then he can calm down 2 to 3 chapatis like that, 1 or 2 chapatis like that.
Okay. And a proper sleep is also very important.
Yeah, it is important for everything. It is important for your BP part also, it is important for your diabetes part also, because these things go hand in hand. They
Okay.
will affect your fatty liver part also.
Okay. Now, doctor, we were talking about the treatment part.
So I was talking about the dietary part.
Dietary part.
So dietary part, main thing is the fast food we are having nowadays,
food we are having.
along with the sedentary lifestyle. So this adds up. And the main thing with the fast food is the use of the fats. We say the trans fats. They used to give foods fried in deep fried. They usually deep fry their foods. And the main problem is that they repeat the oil.
They repeat the oil
Yeah.
with
So
every
this is,
meal they are
this
cooking.
is very injurious to the health.
Okay.
So this causes the maximum damage to the liver by deposition of the fat slowly and slowly.
Okay. So on that note, it's all upon yourself how
Yeah.
you control it. What like measures you are taking, like if you are having a regular meal of fast food, so that is also very injurious to your health, isn't it?
Yeah.
All right. Now, is there a specific oil that one should use at home or for mentioned, especially for the age group we are talking about? If it is an age group, we are talking about an age group before more than 40 or less than 40. So what is the oil one should use?
What we recommend or what is given is we should avoid this saturated fats.
Saturated
like
fats.
butter, ghee,
Okay.
dalda, like these things we have to avoid. And the quantity you have to bring it down. Anyhow, you have to bring it down. This is the main thing.
And the frozen meals are nowadays very easily available, which is also being intaked by many.
See, anything processed, this is far from our gut system is developed like to take the raw foods. Our gut system was not developed to take this processed foods. The more we move away from the raw foods and more we move close to the processed foods, these things will come up.
Absolutely.
These
The body
problems
has
will grow.
got habituated with something,
Yeah.
and then when you take up new things,
Yeah.
so it gets time to adapt that and makes your body not adapted maybe easily, or for the
Sure.
others as well. And depends on the body and body as well,
Yeah.
isn't it? Now, doctor, was there any case history you wanted to share with our viewers at this point in time? You had a hard time to diagnose it and hard time to treat it, and any moment that has given you pleasure, that has given you like a patient has gone happily after treatment?
The problem is that some patients land up with cirrhosis of the liver, as I mentioned, and these patients, they usually come with the liver failure symptoms, as I have told already.
Okay.
There's jaundice, blood vomiting, altered sensorium. So some patients, they come and say, sir, we don't even drink, we don't even smoke,
Okay.
we don't do anything bad, so how come we have this liver disease? So if you take the history properly, you will come to know, oh, he was having diabetics, he was hypertensive,
Okay,
he was
okay.
taking fatty food, but he was not under control. So these things piled up. It is not that in one day they will having this disease.
Okay.
This will pile up slowly and slowly.
Okay.
And when the patient comes to the hospital, yes, there is something bad. And this is the point of no return. If the patient liver goes in the decompensated state, it's the point of no return.
Okay.
If you want a permanent solution for that, that is liver transplantation.
Liver transplant.
This is the last part.
Okay, so one has to know about that early stages as well, and the comorbidity patient has to take an extra care about it, isn't it?
Yeah, if you are having diabetes, if you are hypertensive, if you are having some lipid problems, if you have a family history of gallstones also, then you can think about this, the fatty liver part.
Okay, and like attendance has to be more careful, isn't it? Because like the patients, sometimes they make mistakes, and of course they might be very hard to make them understand that you should not go for this, or you have to change your lifestyle as well. So attendance or the doctors, of course, they play an important role. So on that note, do you also organize such kind of awareness campaigns as well, or a consultation or a counseling is being given to the patient as well as to the attendants?
See, counseling part we do, awareness program we will start slowly, and the main thing to understand is that it is not a 100-meter race.
Okay.
You will come up, you will run, it is over. It is not like that.
Okay.
So the process of losing weight, it is gradual. If you lose even a 1 kg weight per month, it is substantial because it will add up to 12 kgs a year. So that figure is pretty much good. And if you lose 5 to 10% of weight, it will decrease your fatty liver part.
Now, this weight management, doctor, aren't we talking about the aggressive gym thing?
No.
We are just talking about a normal exercise, a physical activity that can be added.
The exercise part is not only for the fatty liver part.
Okay.
This exercise part, it will help you in your cardiac conditions also. And this exercise part will help you in the maintenance of your blood sugar part also.
Right.
So this exercise is overall, it will help you.
Okay. So on exercise part, suppose if a patient comes to you, it is very hard for you to make them understand because they have to understand that this is good for them, the lifestyle management, the exercises, or a proper diet as well. So on that note, do you yourself consult them, or you have a consultant team to give them a counseling part?
We have our counseling part also. In first part, I do the consultation.
Okay.
If the patient is having some problems in understanding, then we can go send the patient for further consultations.
Okay. And also, if suppose a person doesn't want to visit to hospitals, nowadays a notion has come just after the COVID pandemic. So after 2 years, there is a notion that over the phone or online consultation is being done. So do you also provide that to the patients?
If it is necessary, you can give that also.
Okay, because if doesn't want to visit to the hospital, so that can be given as well.
Yeah, that can be done.
Okay, so on that note, do you prescribe the medicines on the phone or on the video call, or do you also ask them to visit you personally and then properly diagnosis will be done?
Prescribing medicine, proper diagnosis has to be made.
Right.
And for that, you need to visit a consultant.
Because proper test will be done, and then only things will be more clear, isn't it? Doctor, we are having really a short of time. So what kind of tips you would like to give our viewers who are watching our show at this point in time, how a lifestyle management can be applied to one of the areas?
See, the key is the maintenance part.
Okay.
If you are applying lifestyle changes in your life, then you have to maintain it. It is not that like for 1 or 2 weeks you are doing and you are living it. You have to maintain that thing.
Okay.
This is the main thing. This is the key for your healthy liver. And the main problem with some people, they come from the interior parts, they take herbal drugs, and this causes further damage. So I request all the patients or relatives, attendants, not to take such herbal drugs.
And there is also a notion among the people, if suppose a gastritis problem you're having or something, like Google is one of the key medicine, or Google is one of the key measure to get all your medicines over that and all the information over that. So how effective is that, or how risky is that as well?
See, Google is a two-edged sword.
Yeah.
You should know how to use it. There are sites which gives you substantial authentic information. You should first know which site to visit, what information to take from them. Otherwise, there is no point in Googling everything.
Okay, so Googling everything is also not that recommended, but it is recommended when you know it's a proper site to visit as well. So, Doctor, we are really short of time. So, any more tips you would like to give our viewers on the exercise part and on the dietary part as well? If suppose a person is not having a time to have a proper 3-time meal, so how munching is important for them, how small meals, or what are the things they can carry with them on their work?
With fatty liver disease, we usually recommend a calorie deficient diet.
Calorie deficient diet.
Yeah, around 500 to 750 kilocalorie less diet he has to take.
Okay.
And if he can take a proper major meal, then small frequent meals are recommended. He can take those diets also. And most important thing is to avoid alcohol.
Avoid alcohol. All right. I hope the viewers who have watched our show must be benefited with the discussion we did today. Well, thank you so much, Dr. Pankaj, for joining to Goodlife, the Health Show. And I hope with this we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.